We're really happy to have Bruce Cohen back with us. He is with the Rockport Board of Health. How are you, Bruce?
Doing fine, thank you.
Thank you. Okay, can you give us an update on COVID numbers over in Rockport?
Sure, happy to. Happy to give you the information, but really need to emphasize the need for continued vigilance. The numbers in Rockport have gone up and are the highest they've been since the beginning of the epidemic. Rockport is now considered a red high-risk community by Massachusetts, by the Department of Public Health mapping system. In the last week, we've had 24 new cases. This is up through Monday. And that's a rate of 47 per 100,000 in our population. Our percent positive PCR is hovering around 5%. And what's been interesting is the change in the nature of this epidemic in Rockport. 36% of our cases are to persons under the age of 40. 35% of our cases are to persons between 40 and 60. And the smallest age group is actually the 60 plus with 29%. As you may remember, the initial outbreaks at Denmark had the epidemic in Rockport looking like focused on just the elderly population. But now it's young families and their kids and working folks. We've been doing a really superb job of contact tracing, and I have to give kudos to Teresa Kirsch and Chassie Robinson, our two public health nurses. And we've tried not only, they've kept on top of identifying cases and their contacts, and they've been helping us analyze the data to get a better sense of where these cases are coming from. And it turns out that over the last month, half of our cases are arise from close contacts or household cases. That's the largest group of cases. And the second largest group of cases is something called unknown origin. People who are doing a good job of adhering to the rules and hunkering down like we are, still go to the grocery store or perhaps doctor's visits, and they're getting exposed because the virus is out there. So about 1/3 of all cases in Rockport are due to unknown origin. I said half to household cases. About 10% right now are congregate living facilities. And then the smallest number, around 7%, is workplace exposures.
So that's pretty concerning, the fact that that large percentage of unknown origin cases. What do you think about that?
Well, I think that's the pattern we're all finding throughout the Commonwealth and throughout the country. Despite people's vigilance, people are still going out and doing things. And the virus is still out there, and the virus will be out there even after vaccination. So the importance of face coverings and distancing and washing we need to double down on those efforts. And it's becoming more difficult to trace, in point of fact, as more people are mingling and exposures increase. Some of it also might be due to traveling for Christmas holidays and Thanksgiving. So I think there are a combination of factors that lead to more unknown origins. But I expect that will probably increase, and that, and that again requires increased focus.
So Rockport, in response to this, has set up some 3 days of free COVID-19 testing. Do you want to tell us about that?
Yeah, happy to. So on January 23rd from 9 to 3, January 27th, which is a Wednesday, from 10 to 2, and January 31st from 9 to 3, there will be free drive-through testing located at the school complex on Ramsden Way. And we're partnering with the Beauport Ambulance Services to do this PCR rapid testing. It's great finally to have testing closer to where we all live and work. Although I need to be cautious. Testing tells you what your status is at one point in time. It's not predictive of how healthy you will be 3 days, 5 days, or a week later. So testing has its limits, community testing. Another testing initiative, which I am very excited about, and which I think the people of Rockport are looking forward to, is exploring school testing. As you know, the Department of Public Health and actually DESI, excuse me, has come out with a program to do 6 weeks of testing in schools. And this is not testing of symptomatic folks, it's testing of students and staff. Initially, DESI is asking communities that are interested in school-based testing to submit a letter of intent. This program just emerged on Monday, and our school administration has submitted a letter of intent that we want to explore school-based testing. We're also going to be tuning into actually a Zoom tonight sponsored by the Broad Institute, which is trying to get school testing going in a bunch of Massachusetts communities. So our goal is, if we have a better understanding of the prevalence of COVID and its infectiousness in schools, that will certainly increase our ability to get our kids back in either hybrid learning, or perhaps at some point full learning, feeling a lot more safe about the school environment. So I'm excited about both of these programs.
So, and is this to test each student, every single student and faculty and every person in the building once, or is this a repeated system of testing as, once a week, everybody gets tested?
The goal would be repeat testing.
Okay.
That's the only way we can, I think, guarantee some sense of continuity. Clearly, it'll be a voluntary program, and if we can get 70, at least 70 or 80% of students and as many staff as possible, we'll have some comfort level that we understand exactly what's going on in schools. We can identify kids and staff who do test positive and follow up with them. And I think the program is a little different than past programs, because initially it's going to be pooled testing. So they'll take all the kids in one classroom, or 10 to 15 staff people together, and they will do a gentle swab and put all those swabs together and analyze them. If no one is positive, then we know that information. If any test is positive, there's rapid, what's called reflex testing, follow-up testing of that group to identify the individual or individuals who are positive. So it's a real, I think it's a real boon to helping understand the current status in an ongoing fashion.
Mm. And is there, moving on a little bit,
Sure.
Are there plans to have the vaccine administered for any part of the population in Rockport?
Yes. Now that our first responders are being vaccinated in collaboration with Gloucester, I want to thank my colleagues in Gloucester for opening up their testing of first responders. Rockport again has indicated to the state that we want to do our own vaccination program as we move down into the different stages. And we're planning to mount a vaccination campaigns here in Rockport. It's been a little difficult because, as I'm sure you're aware, Massachusetts is rolling out vaccination in a slightly different fashion than many other states that have opened up lists more rapidly. So because of the, I think, diffuse public health system where we have 351 towns, as opposed to other states that have more centralized systems, it is a bit more challenging to figure out how vaccination is going to work. But I imagine it will be a combination of vaccination programs for Rockport residents and workers in town, and there will be vaccination available through pharmacies, and I think also vaccination through doctors' offices. And Massachusetts will coordinate all of these vaccination programs through using a sort of a centralized electronic registration system. So everyone will know an individual's vaccination status, where they're scheduled for their first, and how they can proceed with their second vaccination. Those are the current plans.
So when do you think we will know, I'm a Rockport citizen, when this vaccine plan is in place? And who should I talk to? Who should we contact?
Well, I go on the DPH website every day to see if there are any updates on vaccination plans. There was a new one yesterday where they expanded the end of phase 1 or the beginning of phase 2 to include congregate residential senior apartments. We're all waiting to see when we will be able to move more fully to phase 2 that will begin vaccinating 75 plus essential workers and then begin filtering down. Heather, I wish I had a better answer for you. I have no inside information, and I think we're all anxiously awaiting more access to vaccine being provided and understanding the distribution routes so we can all sign up and get vaccinated. I wish I had more.
That's okay. No, it's good to know that we're not missing something right now.
Yeah.
You know, that's actually what I needed to know.
Yeah.
So, and we will be checking in with you again soon to find out about those updates.
Yeah, I think another piece that I really wanted to mention, as the rates do go up and they're surging in Cape Ann, not just here in Rockport, certainly in Gloucester as well, it's really important that we double down in our efforts to communicate and understand the situation. So here in Rockport, we're thinking of different things we can do. And some of the ideas that we've been discussing are increasing the meetings of the Board of Health to discuss issues for vaccine planning and testing. So we're going to begin to be meeting weekly. And we're recommending that the school committee and the school administration keep in constant touch. And we're scheduling hopefully more meetings of our clinical team with the school nurses. We're going to be, I think, increasing our social media presence and doing more announcements. We've had an incredibly successful program where Mitch Vieira, our town administrator, has contacted everyone through reverse 911 on Mondays. It's become a routine announcement. We're thinking about interspersing that with perhaps other voices at other points in time to emphasize the importance of maintaining vigilance in this time of surges. So I think there are a bunch of things we should be considering. We've even talked about maybe encouraging people to keep 12 feet away rather than 6 feet away. If they are meeting friends and family indoors, make sure all the windows are open, or taking breaks perhaps every half hour and letting the space air out. You know, we're certainly encouraging people to examine what kind of masks they're using. Some masks are more effective than others. So I think it's the duty of all of us to sort of re-examine what we've been doing and even do more if at all possible.
Well, Bruce, you always find a way to bring all the news to us. It's like a CBS receipt of information.
Well, I hope, unlike the CVS receipt, you look thoroughly at the details.
Yeah.
I don't know how much more time we have, but I just wanted to step back for an instant to sort of expand my plug. You know, when we pour a glass of water out of our tap, we expect it to be clean. When we go out to eat, we expect the food not to make us sick. When we buy Christmas presents for our kids and grandkids, we expect them to be safe. When we stroll to Dogtown, we expect the air to be clean. You know, these are the things that public health has done and continues to do. And I think people take these things for granted. They just are. You know, now's the time when public health is really front and center. And I think we all need to be public health activists and really focus on how we can contribute to our own individual health and keep our friends, our coworkers, and our community safe together. So this is my mantra. We all need to be public health activists at this point in our lives.
Right.
Well
Well,
said.
that's the title of the show.
We appreciate your time, Bruce, and we would love to follow up with you again. And please stay healthy in the meantime. And we appreciate your work.
Yeah. Thank you for all the work you're doing.
My pleasure. And thank you for, you know, keeping this alive in front of our communities. It's really, communication is really, really important.